For the best in talk, entertainment, and great giveaways, you're in the right place. Coming up next from the entertainment capital of the world, the Amie Jo Show. And we're going to be talking about plastic surgery. Welcome and thanks for tuning in. You're watching the Amie Jo Show, and I have a fabulous show prepared for you today. We're going to be talking about plastic surgery, and I have a wonderful young man here with me, Dr. Hankins. He's probably one of the foremost users of implants in the United States, and what's more than that, he is one of the most sought after individuals when it comes to facelifts for men. What do you think about that?
Thanks for the introduction, Amie Jo.
Is that all true? And you're modest. You're modest on top of it. Well, you know what? No time for humility, because guess what? I have a card here, and it's filled with credentials all about you. I can't even memorize this because guess what? There's so much. He is the former chief of plastic surgery at Sunrise Hospital. He is also certified by the American Board of Plastic Surgery. He is a member of the American Society of Plastic Surgeons. And on top of that, you belong to a very special organization called LEAD. Tell me a little bit about that.
The LEAD meetings began a little over 5 years ago. One of the implant companies brought together some of the surgeons who do a lot of breast augmentation surgeries and began to let us share ideas. And that meeting's been going on annually, and it's one I really enjoy, and it's a great opportunity to learn from people who really do a lot of surgery.
Yeah. Well, I think it's very important to preface everything that you're going to say today about plastic surgery and help people to understand that you really do have the credentials and that you are an expert in your field, because we both know that there are people out there who are not necessarily experts. And people go to them, sometimes it's not a good outcome.
Yeah, unfortunately, we've tried to help patients understand who is qualified to do different procedures, but you're seeing, certainly some horrific outcomes. In Las Vegas alone, there's been 2 deaths just from patients that have been wanting to get larger butts. So in hotel rooms or in the back of a tile shop, they've allowed people to inject themselves with silicone.
Wait a minute. Did you say in a hotel room they are doing cosmetic procedures?
Yes. People are coming from once, one individual was from Colombia, another time from Miami. And, for the saving a few dollars, or because they've been told that it's not a good idea that they would do this. For example, injecting free silicone is not a good idea.
Wow. Well, you know what? I won't go into all those details because we have so many great things to talk about, really positive things. First, let me find out what brought you to plastic surgery, because there's so many areas in the medical industry that you could have gone to. What brought you to plastic surgery?
Well, I guess the credit goes to my older sister. She was about 3 years older than me, and she became a plastic surgeon. So she was in residency when I was making my decision. So I had even more exposure to the field. As a medical student, you get to see lots of different specialties, and you have to make a decision in a relatively short amount of time. So I got to see some of the variety that plastic surgery offers on more of a first-hand basis.
Wow. And so how long have you been here in Las Vegas?
Since 2004.
Okay. And how many facilities?
We have an east side facility at 60 North Pecos, and then a west side facility at 2150 Rainbow.
Okay, and this facility that we're in, is this the new one or the old one?
We've always had an east and west side location, but both are relatively new, and this is a 7,000 square foot facility, and on the west side It's 10,000 square feet. But we do most of that. Has a hair salon and some other things as well. We do most of our surgical consults and procedures on this side of town.
Well, this is in fact a huge facility. When I walked in the door, I was blown away because there were corridors and doors, but that just means you have more opportunity to perform more procedures on people. So let's talk a little bit about something that I think a lot of people are very familiar with, and that is breast implantation. There's a lot of words out there. There's reconstructions, there's lifts.
I think that there's all kinds of different things. Certainly reconstruction, augmentation, reductions, breast lifts. I think it's an exciting time for breast augmentation in particular. Because we do have a new implant that just recently got approval, and kind of the lay term for it has been the gummy bear implant. I think it's important, and it's a great opportunity to be on your show, and I thank you for inviting me to really help people understand what that term means and whether this implant might be right for them or whether it really even presents in advance.
Well, I'm going to just hold everybody in their seat just a moment longer. We're going to take a quick break. And when we come back, I want to talk a little bit more about the gummy bear and really find out what it's all about, what the difference is versus the saline and some of the other things that people have been offered in the past, and why the gummy bear is maybe something they want to be interested in right now.
Great.
Okay. Now, I said a lot of nice things about this doctor in the beginning, but guess what? Some of his patients are in magazines. Some of his work is in magazines like Maxim and Playboy, which is probably where you remember me from. No, not really. But stay in your chair. Don't go anywhere. We'll be right back.
Hey, gorgeous, I'm starving. So what do you feel like eating? breakfast, lunch, or dinner, nobody can cook up authentic Mexican dishes like Roberto's Taco Shop. Whether you're eating in or want it to go, Roberto's prepares it fresh and delicious the way you like it. And now you're going to like it even more because on Tuesdays you can get a wet burrito combo for just $2.99. Our famous mouth-watering bean and cheese burrito covered with enchilada sauce and a medium drink. Roberto's 24-hour taco shop.
You like?
I like.
If you need cash now, everyone knows that MJ Christensen will pay you the highest value for your unwanted gold. Diamonds, scrap jewelry, broken gold chains, fine watches, and estate pieces. Come in today and see how you can get immediate cash for your hidden treasures. Plus, only MJ Christensen will double your cash value when you choose an MJ gift card instead of cash. That's right, double your cash. Only at MJ Christensen Diamonds. Family owned since 1939 with 2 convenient locations to serve you.
Welcome back, and thanks for staying with us. You're watching the Amie Jo Show, and I am here with my expert guest, Dr. Hankins. We were alluding to the fact that there's a new product on the market, gummy bears. What in the world is a gummy bear?
Well, it's an implant that was originally, we began to hear about it almost 10 years ago, and this is the gummy bear implant. But in order to kind of really demonstrate what it provides to our field and what it offers patients, I'm going to do a real quick kind of summary of the history of implants. This is one of the old Dow implants. These are the implants that kind of got a bad name in this country and led to a moratorium on silicone implants in this country. So for a while, all we had was this implant that many people are familiar with, and this is a saline implant. It's a silicone shell with a valve, and we fill it with salt water.
Now, are these the ones that were leaking?
These are the ones that essentially replaced these Dow implants, which did leak. And when the problem was, when they leaked, and they leaked at a fairly high rate.
It's very soft.
50% at 10 years, which is what the original idea behind this implant was. But I'm going to cut this implant just to demonstrate kind of how the silicone within the shell leaks.
Oh.
And it just really goes outside the shell and gets all into the breast tissue. And this led to surgeries that were fairly difficult to get this material out of. It's pretty sticky.
Ah, yes.
Yeah, you're gonna, yeah. So then, for about almost 10 years, this is what we placed in patients.
Okay.
In 2007, the FDA approved this implant, which is a different level of cohesivity. Cohesivity is referring to how the silicone sticks together. So these are the implants that we've been placing then for the last 5 or 6 years. The difference between these is when it leaks, it tends to stay within the shell. I'm putting pressure and it's tending to go back into the shell. So even a rupture or a break in the shell is not going to typically lead to a difficult surgery to get the material out.
Okay.
So this would be considered a level 2. Without getting your hands sticky, just feel this implant.
Okay, yes.
So last year we got approval of a new implant company, and this is a Sientra implant. Unfortunately, some of the plastic surgeons in this country have started to advertise that they had the gummy bear implant when this got out. Since gummy bear is a lay term, it's not really necessarily that they're doing anything wrong by advertising that, but I think it's somewhat misleading.
Okay.
The original gummy bear term got associated with this implant. This implant is much more cohesive, or it basically sticks together than this implant. And the reason that's important is because it maintains its shape better. You can see how this implant essentially collapses and has rippling. This implant, one of the advantages to this implant is going to be those patients who may not have enough tissue coverage and might see the implant through the skin and even the muscle. This implant's going to have less rippling or ability to see the shell of the implant. So what I'm going to do is just cut these implants and show you the difference between a form-stable implant and even the cohesive implant. This implant is even more firm.
And still the sticky substance
Still,
inside. Okay.
Still, all of these implants have silicone inside except for this implant.
And that's a very watery fluid.
Yeah, this is
Okay.
just like essentially like water with a little bit of salt, saline fluid. Okay. So if this implant fails, essentially you might not even really be able to know it, which is essentially that's why we get MRIs and things. But the reality is it's going to fail at a lower rate. And that's an important thing. Sometimes people are confused. There's still a large number of patients that feel that saline implants are safer. But the reality is, since it has a valve, the likelihood of having to have an operation is a little higher for a saline implant than for any of these newer silicone implants.
Who is a candidate for this type of an implant?
I think this new form stable, or for the lack of a better term, gummy bear implant, is going to be good for a patient who wants a very natural look. Maybe not quite natural as a feel, because remember, it's going to feel a little firmer than this implant that we've been using.
But shape-wise, it looks more like the shape of a breast.
Natural breast.
Yes.
So less upper pole fullness. It's a shaped implant, and that's the reason that it has that textured shell to prevent it from rotating. Or a patient that has such thin tissue coverage that you might be worried about rippling or seeing the edge of the implant is going to be a patient that this. I would say in our practice, we're about 95% silicone already. Patients choose silicone, and basically because we let them feel the implants. The silicone feels much more natural, and most patients like that.
Yes.
We're going to do the same thing with this, and patients may like that this feels more natural, the implant that we've been using, but I would say that this is going to appeal to about 10% of patients. They're going to have an advantage to this new implant.
So is there an age restriction on implantation?
There is.
Okay.
Both the FDA and the American Society of Plastic Surgeons says that you should not perform breast augmentation on a patient that's less than 18 years old.
Okay.
They also, the FDA further came out and said that silicone should be used on patients over 22 years of age. So except in the case of a breast deformity or a chest wall deformity where silicone is very important to use, that basically limits the use to patients over 22 years of age.
So when someone has an implant put in, can their insurance pay for something like that, or do they view this strictly as cosmetic? What if someone's a cancer patient or something?
Yeah, almost in every case, the reconstruction after cancer, even after sometimes only a partial mastectomy or a lumpectomy, is covered by insurance. Even the procedure on the opposite breast to obtain symmetry is covered.
Okay.
On the other hand, even for genetic cases where underdevelopment of a breast, severe breast asymmetries, that can be much more difficult to get an insurance company to cover. They would consider that cosmetic in many cases.
So is this the implant of the future?
Great question. I think the answer is no, but it is another tool in our armamentarium of giving patients great results.
Okay. Thank you so much for that information. And the thing about the age, people might think that that's crazy for me to ask, but there's been a wave of young people getting procedures. And I want people out there to know that this is not for young people. This is for the mature woman. So we're going to take a quick break. When we come back, fellas, I promised you I have something for you. So stay right where you're at. Don't touch that remote. We're coming back and we're going to show you and talk to you about everything that your friends are doing and they didn't tell you.
This holiday, unlock the magic with a gorgeous sterling silver key pendant. Finely crafted at the highest quality. Your choice only $79. Hurry in before the magic is gone. Now at both MJ Christensen Diamond locations.
As for me, I'll catch you when you fall. Catch you when you fall. 'Cause your fall was just a stumble. Life is not through.
If you need cash now, everyone knows that MJ Christensen will pay you the highest value for your unwanted gold. Diamonds, scrap jewelry, broken gold chains, fine watches, and estate pieces. Come in today and see how you can get immediate cash for your hidden treasures. Plus, only MJ Christensen will double your cash value when you choose an MJ gift card instead of cash. That's right, double your cash. Only at MJ Christensen Diamonds, family owned since 1939, with 2 convenient locations to serve you.
Welcome back, and thanks for staying for the whole show. You're watching the Amie Jo Show from the Diamond in the Desert, Las Vegas. And I am here with my expert guest, Dr. Hankins. We've talked about breast augmentation, and now we are going to talk about the secret that men have been hiding. They're getting treatments and procedures. And so what's the most popular thing?
I think the thing that's driving men to have plastic surgical procedures is that they realize they can do it and still look very natural. Mm-hmm. So I think they're interested in Botox and Dysport, 2 of the neuromodulators. They're interested in fillers as long as they're done well and still give them a very natural look. They're interested in mini facelifts, liposuction, lid surgery, all of these things as long as it's natural and they don't end up looking like, for lack of a better person, Kenny Rogers.
Okay.
And a lot of men come in and say that. As long as I can do it and still look like me, then I'm all for it.
So is this going to be a large part of your business?
Yeah, I really think it's grown now. I think it used to be less than 10% of our patient population. We're well over 20% of our patients are men now, and it still is growing each year.
Do you also think that a lot of men now are looking at this as a way to extend their corporate life because people are working longer and they want to look better longer?
Yeah, we certainly hear that from men that are still in competitive industries like sales, that they want to look the part and be able to compete with their younger cohorts. Yeah. I think the other thing that drives it is men are willing to share. If they have a good result, they're not shy about telling their friends that, look, you can't find the scars after the mini facelift, or I had Botox done, look how much more natural, these wrinkles are gone, but I still look natural.
Right. And do you feel like these men that are coming in are just high-end men, or is this open to just really like the casual guy who just might want to look good?
Yeah, that's a great question. I think that, our practice tends to be, we certainly have some high-end patients, but, we're a middle-class practice, and I think this is something that people, once they realize it can make them look better and that these things don't have to cost that much, there's really from all walks of life.
Yeah. So if a gentleman comes in to have a mini facelift, what is the downtime for him?
Probably a good week of social downtime.
Okay.
If they don't mind, because men can't use makeup and a lot of them have short hairstyles, if they really didn't want anyone to know, it might be as long as 2 weeks. Okay. But the mini facelift is popular because it's certainly not the downtime that you associated with the older kind of standard facelift that we did.
Right, right. And so what is the typical age group when a person would come to you to have a procedure like that done?
I think, that certainly we all kind of start feeling age, as young as 30, but typically for a mini facelift, mid-40s all the way up to 70 now. We've realized the mini facelift is a pretty powerful procedure, and even in older patients can really offer a great result with less risk and less downtime.
Okay. And I think we have a video for a mini facelift. Did you have a mini?
Yeah, on our website
Yes,
we have
yes.
the procedure being done under local anesthetic, which I think has become more and more popular. Although we still do a number of these procedures under general anesthetic, it's really a patient preference at our office.
Okay.
So yeah, your viewers can go and watch the procedure being done and see how comfortable patients are when they have this done under local anesthetic.
Okay, and what's your website?
It's www.hankinsplasticsurgery.com.
Okay, and one thing we neglected to do was to get your telephone number so people can call, make an appointment, get a consultation.
Sure, it's 897-1330.
Now, one last thing I want to cover with you is oftentimes I hear that women and men as well of color are a little apprehensive about having plastic surgery done because of the scarring and keloids. Is that still an issue?
I think it is, specifically for black patients who know that they have a history of keloids. You have to be very careful. But that's actually a very small percentage of black patients. So I tell my patients, if you've had injuries, you've had surgery, and you've not had a problem, even ear piercing is a good thing to look at. If you've not had a problem getting your ear pierced, you are not likely to have a problem with surgery. Some of our other ethnic groups, I worry even a little bit more. Certainly Asians are prone to scarring. Oh. So it's any ethnic group has a certain propensity to scarring. We want to discuss that before we do surgery.
Yeah. Well, we have an array of products here, and what are these?
Well, these are just some of the different non-invasive things that are available. We also have lasers. Ultherapy is a new procedure that uses...
And what is ultherapy?
That uses ultrasound energy to create heat and then create collagen formation, which tightens skin. So the array of non-invasive things that you can do it just continues to grow, and it might even get confusing for patients at times. Yeah. And I think that's why it's important, I believe, to seek out a plastic surgeon who offers all of these things. So, if you're a better surgical candidate, they can lead you that way. Whereas, sometimes if you go to someone who only offers one of these things, you're going to end up with that no matter what.
Well, you know what? I feel like I didn't truly do justice to your organization here because you have so many things that you offer. So I guess I'll just have to come back and we'll just start all over again and we'll talk about a couple of new things. How about that?
That'd be great. We'd love to have you.
Okay, great. Well, right now it's time for Watch and Win. So grab your pens and your papers and write down this number, 855-246-6678. And the doctor is graciously going to help you with some Botox. So be my 10th caller, leave your name, your email address, and your phone number, and we'll call you right back. Again, that's 855-246-6678. And that's it. It's a wrap. We're all done for today. Thank you so much for joining us. If you want to know more about who we are and what we do, please go to our website at www.amiejo.org. As I say today and always, success is a choice. Change your mind, change your life.